Hello, dear aquarist. Welcome again to one of my cases of fish diseases, already number 261. Yes, I had previously already 260 cases. Try to watch them because many interesting videos I show about disease, tetras, cichlids, discus, you call it. Many different species I've been examining during my work as a consultant. And today it's about a Moenkhausia sanctaefilomenae, which had serious disease signs. Those fish were wasting away and had terrible outbreaks of red ulcers. And I show you how they look like in the microscope, but first of all, how it looks like in the aquarium. So I found a serious case of fish tuberculosis. Yes, this can happen unfortunately when you're dealing with ornamental aquarium fish. Details about fish diseases, prevention, control, diagnosis, treatments, everything you can find, and good references of other books in my books on fish diseases, and the link is below. Here we see the Moenkhausia in the tank, and you can see some of the damaged fish. I pulled out a few so you can watch very closely how badly damaged those bodies are. White, reddish, necrotic lesions. The fish are suffering, Popeye. They had so many different issues. Here we see them again, ready for our examination or dissection. You see the bloody part, you see the tail rot, you see the bad, heavily respiration, you see the fish dying. So objects for examination. And then we took a skin scraping and we found in the scales, on the skin, all tubercles. Here, quite a few here. And here, on the other parts, all tubercles inside the scales. That means there is an outbreak of an infection on the scales, and the tubercles are caused by a reaction of the skin to defend itself, to encapsulate the bacteria. And in many cases, or in most cases in studies that have been presented, and I discuss that quite often in my YouTube videos, in most cases, 85 to 90%, it's fish tuberculosis that the laboratory can determine. We also checked internally the organs of the fish, and you could see the badly infected organs full of tubercles and hardly any healthy tissue available in those organs. You can imagine the fish will die. So, what can you do as a treatment? Well, not for those that are so badly damaged. You better put them gently asleep, euthanize, like with a product of Narcomore Plus. There are many more products, but that's an example that you can use. We suspected Mycobacterium. Well, we know that it's difficult to treat the bacteria because they're encapsulated in tubercles. Some people tried antibiotics, but the results have no guaranteed success due to the tubercles or the bacteria protected against the antibiotics. Some fish that have a little infection might survive for a long time or permanently when they are kept in good condition. On the moment when there is stress or other infections occurring, they will, of course, come down with the disease. The breeder is the cause. There, so they should work on a good biosecurity and a prevention in controlling the broodstock and the healthy maintenance of the water system in the tanks where they're breeding the fish. And you, as an aquarist, you can help with a functional fish food that helps this fish during this kind of infection. And we recommend for this kind of infection to help the more healthy fish, the less infected fish, with our Dr. Bassleer Biofish Food Fickle. Details on fish diseases, prevention, control, treatment, good diagnosis. See my books, and the link is below where you can order them. You can get training on causes of fish diseases or good diagnosis or quarantining fish when they arrive from the wild or from your suppliers, marine fish or freshwater fish. All that you can learn at my Patreon. So I hope this video brought you some attention to a serious bacterial infection that you can examine with a microscope, particularly when you find the tubercles. I hope this teaches you a lesson. Subscribe to learn more. Thank you for watching.